Tom Haren speaks for the Coalition to Regulate Marijuana Like Alcohol. It brought the proposal to the legislature in January, and when lawmakers did not act, the group gathered nearly 125,000 valid signatures to put it before voters. I asked Haren about some of the concerns raised about Issue 2.
The legislation establishes a THC limit of no less than 35% for plant material and no less than 90% for extracts. And there's been some concern about those numbers. Opponents have described that as extreme and dangerous. So why are those limits set as they are?
Well, just to be clear, those are maximum amounts of THC in products, right? That means
even though it says no less than.
Yeah. So what that section means is that when the Department of Commerce sets its maximum amount of THC content, that limit can't be lower than 35% for plant material, for instance. And the idea there is to prevent monkey business in the promulgation of rules where there's a THC content limit of like 0.3%, and then it's all just hemp products in the adult use market, right? These are, under Ohio's medical marijuana law, the THC content limit is 35% for plant material. So again, we're building off of the existing regulatory infrastructure, and we wanted some agreement between the medical rules and the adult use rules to the extent that we could, that it would make sense for that. So we looked at best practices from other states, what content limits did other states set, and that's ultimately, where we arrived at the content limits under Issue 2. So again, those are maximum amounts. There will be a lot of products with much less THC being sold in an adult use market. I would suspect that actually the majority of products would be far lower from a THC content limit. So those are maximum amounts of THC.
But not less than 35% for plant material.
The maximum amount, the department can't set a maximum amount of lower than 35%. So you will have marijuana plant material that's at 11% THC or 5% THC or 15%. I mean, it all depends on the unique strains. One of the advantages of an adult use program is that it provides access to medical marijuana products that aren't available to a number of patients. Like we've talked about in the past, Karen, if you're a veteran suffering from PTSD whose VA doctor can't issue a recommendation, or you're a cancer patient treated by one of the major health systems that refuse to allow their doctors to recommend medical marijuana. For a lot of those patients, they need products that have a little bit higher THC content. And we wanted to ensure that we provided meaningful access to those patients under Issue 2.
The business groups that are opposed to this are concerned about worker productivity and safety. They say employers will have to bear the cost of testing and possible liability. And they say that'll put a big hole in economic development plans and expansion because companies will go to other states where marijuana is not legal. A study from July 2020 from the National Institute on Drug Abuse showed employees who tested positive for marijuana had 55% more industrial accidents, 85% more injuries, 75% greater absenteeism compared to those who tested negative. So doesn't that show that there is something to worry about when it comes to legalized recreational marijuana?
No, absolutely not. And in fact, those statistics can be very misleading. Again, when you look at testing for marijuana, we know that marijuana stays in your system for days, if not weeks at a time. So if somebody has an accident on Friday, but they consumed a cannabis edible on Monday and they test positive, nobody in their right mind says, what caused your accident on Friday? It was the edible that you ate 4 days ago, right? There was a study done just this past August, a longitudinal study, meaning a long-term study conducted in Canada, where marijuana has been federally legal for several years now. And that longitudinal study, the best study that we have of its kind, found that there is no difference in workplace injury risk for those workers who use marijuana outside of the workplace, right? Nobody thinks it's a good idea to show up high to work, just like nobody thinks it's a good idea to show up drunk to work. But we do know from Canada, from the 10 years that we've had regulated adult use markets in 24 states, that there is no greater risk of workplace injury after a state takes the step to regulate the sale of marijuana for adults. And in fact, there's actually data to suggest that workers between the ages of 40 and 62 actually are more productive because they have other alternatives to manage chronic pain and they don't need to turn to prescription drugs or opiates.
You mentioned the money and the revenue that's generated. One of the things that opponents have said is that legalizing marijuana will have social and economic costs that taxes won't pay for, and that none of the revenue is going directly to law enforcement. Why is that?
Well, look, there was recently a fairly conservative study conducted by Shoto Analytics right there in Columbus that again verified that issue 2 will have a net benefit to the entire state of Ohio to the tunes of hundreds of millions of dollars. And as I mentioned, through that host community cannabis fund, if a local community that has a dispensary needs more law enforcement officers or wants better equipment for law enforcement officers or more training for law enforcement, they'll have the funds to get that training, to pay for that equipment, or to hire new officers.
And you talk about the Social Equity and Jobs Fund, and some folks, including state lawmakers, are concerned. The legislation says a cannabis social equity and jobs program shall provide financial assistance and license application support to individuals most directly and adversely impacted by the enforcement of marijuana-related laws who are interested in starting or working in cannabis business entities. Now, Senate President Matt Huffman has said he wants to address that, which he calls the convicted drug felons who will be giving preferences for getting licenses. Auditor Keith Faber calls that the drug dealers and families fund. Can you explain why 36% of the revenue is going into this fund and what it would do?
Yeah, so the Social Equity and Jobs Fund has a much broader application than what our opponents are telling Ohio voters. This is another example of their attempts to mislead and scare voters in the last few days of this election because they can't rely on the facts. I mean, under the Social Equity and Jobs Program, that money goes in part to provide financial assistance to people who apply as a social equity applicant. And by the way, there are a number of ways to qualify as a social equity applicant. It can be based on either social or economic disadvantage, right? Including like long-term residence in an area of high unemployment, can be based on ethnic origin, gender, disability status, etc. And then the Department of Development can establish those prior criminal interactions that might also qualify. But nobody expects a felony drug trafficking charge to qualify somebody. These are qualifications that are set by the Department of Development. They're not set out in issue 2. So the money that gets generated by the Social Equity and Jobs Fund in part goes to provide financial assistance because, again, one of the ways you qualify is by not having money. We want to ensure that the adult use cannabis industry in Ohio is representative, that it's easy to be a part of, so that we have lots of small businesses and entrepreneurs who are able to participate in the adult use market. And so, yeah, there is a part of it that goes to helping with finances and technical assistance. But as I mentioned, it also goes to study and fund these important criminal justice reform efforts, as well as I mentioned, direct investment in disproportionately impacted communities to enhance education, entrepreneurism, legal aid, youth development, violence prevention. I mean, so the Social Equity and Jobs Fund is about reinvesting and restoring communities throughout the state that have been harmed by marijuana prohibition.
Issue 2 would not require expungement of criminal records of people convicted of marijuana-related crimes. Haren said the group did not address that in the proposal because of concerns it would be broken up into multiple issues, requiring multiple rounds of signature gathering.